Hello everyone, Mark Leorna, Business Development Manager here at Advantech. Today, I'll talk about hospital digitalization technology and how it can help tailor and deliver precision medical care, and how it can improve the overall patient care. More importantly, on why is it pertinent and beneficial for healthcare institutions to digitalize their nursing process and have an integrated healthcare system. Without a doubt, nursing is a high-pressure career. Nurses are responsible for providing patient care, assisting in medical procedures, documenting treatments, administering medication, and many more. With all of these duties and responsibilities, ward nurses face tremendous amounts of challenges such as high nurse-to-patient ratio, excessive nurse workloads, increased safety risk, reduced quality of patient care, tedious and repetitive workloads, time-consuming paperwork, and lastly, lack of data integration between hospital information systems. Advantech's iWard solution, intelligent ward management platform, is patient-centered healthcare platform and an end-to-end solution. iWard solution is specifically designed to aid our healthcare workers in their day-to-day tasks and help improve patient care quality by providing a scalable and flexible integration of patient engagement systems and ward management. Let me show you the overview of our iWard solution. What we have here is what we call the nursing station. And under our nursing station, we have our mobile cart solution. We also have our nursing dashboard and the nursing control station. And these are very essential to check essential announcements, staff schedules, notification from patients and doctors, and also ward statistics. Let's jump into a more real case scenario here. With our iWard, nurses can have their own workstation, just like our mobile cart, with iWard software installed. And as they go through the ward rooms, they can actually have the interface, and they can use this iWard as their primary interface to update patients' information, taking nursing history, and to attend the patient care needs. Our iWard interface is specifically designed to be user-friendly, to make them intuitive for our nurses. Most importantly, to minimize the input errors, prevent nursing errors, and have a quick adaptation to our iWard workflow. With our mobile iWard, nurses can actually have our mobile workstation, just like a Miss 50 Echo or even a tablet. So with this interface, nurses can actually see the whole information of the ward. They can see each patient's information. They can also update any of the ward information through this interface alone. And when they want to review any of the patient information, they can go through from the basic information. They can also see all the vital signs and also update the vital signs. They can also check any ward records. They can create any ward records for any of the medications or any of the wounds that they need to update into the system. And at the same time, they can also check all the drug information, the medications that has to be provided to the patient itself. Now, why do we actually have this? Is because we want to have our iWard to minimize the input errors, prevent nursing errors, and also to have a much better and quick adaptation of our workflow to our nurses. Let's talk about our nursing dashboard. Our iWard nursing dashboard can support full HD displays and even 4K displays. It can also be interactive and touchscreen, just like this one. Okay? And with our nursing dashboard, nurses at the station can have the complete visibility of the wardroom's capacity and conditions. On the right-hand side of the panel, you can see here are the unresolved and pending notifications created from our patient information terminal, just like what we have created a while ago. Through our dashboard, nurses can also have the access to the patient's and bed information by station, nurses' shift information, and ward statistics. Talking about our nursing dashboard can actually support multiple types of displays. You can have a full HD display or a 4K display. All displays can actually be interactive, just like this one. And from here, the nurses could actually review all the ward information, and they can also review each patient's information right from the get-go. When nurses at the station trying to review any of the patient information, what they could see here is the name and all relevant information, including the latest vital sign information as well. We also have the medication information that they could actually view from the dashboard. And then lastly, they can also review all the notifications created from the nurse call or from the patient call itself. Now, this dashboard actually has two parts. On the left, you could see all the ward information, the overview. And on the right side, we could actually see here all the unresolved notifications that were created from the patient call. That means the nurses can have the visibility of which patient or which ward they have to attend to right at the beginning. Next one is we can actually see here the ward statistics. We can actually see here the map of the hospitals in case of emergency. We can also see here all the treatment plan that are scheduled. So they know, or the nurses at the station, they will know which patients and which wards are taking any surgery or has to go to a specific scheduled treatment just right from the dashboard itself. We can also see the nursing schedule from here. The nursing schedule will tell all the nurses at the station whose nurses will be assigned to which ward and to which patient at a particular schedule or a particular shift. Lastly, we also have the announcement dashboard. So from here, you can actually see all the hospital announcements or the ward announcements itself. These are all customizable right on the get-go from our server itself. And now let's move on to our nursing control station. And in our nursing control station, it can also receive patient notifications just like this one and can be resolved into one click. Our nursing control station, being the core application of our iWard solution, carries a lot of features and functions that can help nurses access, update, and also display the patient information with just few clicks. And then all the updates can be automatically synchronized back to the hospital information system. What else can actually the nurses at the station can do with our control station? Number one, they can actually review all the patient information. Okay. They can also update and create patients right to the system. But at the same time, they can also do a lot of different customizations. For example, here, we can actually create remark settings. So the remark settings is if they want to display such kind of information towards the ward widgets, they can actually customize right in here. So they can upload their own icons. They can rename each specific remarks right on whichever fits on their ward specification. And at the same time, they can also create different status settings. Another one is we can actually create nurse schedules from here. So if we want to assign a nurse to have a different schedule, say, let's say Kathy right here, and then assign her to a specific group for firefighting and assign to a specific shift, just like this one, and select the wards that will be assigned under her. It's just in just few clicks, we already have a new nursing schedule. Another one is we actually have the ward statistics. In here, you can actually see all the different types of notifications created right from the patient information terminals. These are the patient calls. What are the needs of the patients? And you can see here which patient actually has the most calls and which patient actually has been attended more often. In this way, we could actually see which patient needs more attention and has to be moved towards or move nearer towards the ward station to be attended right away. We also have different setups and also the data management right in here. And at the same time, you could see also the overview of the whole ward itself. Our nurses can have access to the ward management information, and they can also customize remarks and other information to be displayed to our patient information terminals. They can also check and update patients' vital signs, do ward checks, treatment plans, and medication information. They can also set alarm clocks, view the nurse schedules, and the ward statistics. And that's more into the deep dive into our iWard solution in our nursing care flow and how it can be implemented in a real case scenario. With our patient care solutions, we have bedside information terminal. We have patient information terminal, which allow the patients to send requests to the staff nurses, check their medical information, and also treatment plan with their schedules. And lastly, we have our doorside and bedside e-paper display that is highly energy efficient and can be updated in almost real time through our iWard nursing station. Nurses can have an efficient and meaningful interaction with the patient using our patient information terminal. With our patient information terminal, nurses can show the medications, treatment plans, and schedules to the patients and have an interactive patient education. At the same time, the patient can also view their schedules for tests or surgery, can also get the reminder whenever they take the medication, and review their exam results. Moreover, the patient also has a call to action buttons in case they need to be attended immediately. These call to action buttons are fully customizable to fit the need for every different kind of patient attention scenario. Once the patient clicks this button, it will automatically notify the attending nurse and it will display the notification to our nursing control station as well on our nursing dashboard. With our patient information terminal, the patients can have a very comprehensive overlook of all the informations that are needed to be attended to when it comes to the patient. So on the right side here, we can actually see the patient information coming from their name, the medical records, and also the remarks. These remarks can be set by the nurses using their nursing control station. And at the same time here on the left side, the patients can have access to any relevant information, not only including for the hospital floor mat in case of emergency, but also any other education or any material that could relate to any patient education in terms of how can they actually provide such meaningful information to the patient wherein is related to their specific illness. The patients can also access their own schedules in terms of treatment, surgery, or any other related examination on their part. And at the same time, they can also review what is the complete detail of the surgery and also the examination. Patients can also review their medications. In here, they can actually see all the information of the drugs they are going to take, and at the same time, what relevant information they need to know. Not only for the possible side effects, but also the possible allergies that they're actually taking into. And at the same time, patients can actually rate the satisfaction they're having based on the services of the nurses and the hospital being provided. So for example, in here, the patient can actually rate if they're very satisfied or very dissatisfied about the services of the hospital. Now, lastly, what we can do is patients always have the access for a quick call to action to the nurses. So they can actually call for SOS in case of emergency. They can also create bedside assistance if they need their bedside to be replaced and also be updated. Now, all this information or all these call to action buttons will automatically send notifications right to the attending nurse, to the nursing control station, and also to the nursing dashboard. Advantech's iWard solution can help alleviate strenuous workloads that nurses face daily by providing a platform that integrates nursing process functions into the healthcare system for fast and easy access and also allows interactive patient education. iWard solution facilitates collaborative decision-making, improves patient outcomes, enhances the quality of care, and lastly, it enables the healthcare institutions to meet international standards for continuous quality improvements. It was a great pleasure to present to you our iWard solution. I hope that you learned something about the importance and benefits of our solution to the healthcare IT industry. We are hoping for a greater partnership to enable our iWard solution to help every healthcare institution worldwide deliver precision medical care and improve better patient care. If you have any further questions or would like to know more about our healthcare solutions, feel free to reach us through email or LinkedIn. We hope to hear from you soon. Thank you very much, and I wish you all a blessed day.